Afternoon, everyone, and thank you for joining us to learn a little bit more about menopause. My name is Angelique Rodore, and I'm an OBGYN practicing in the West region. For the past 6 years, a meaningful part of my practice has focused on menopause care, and I have seen firsthand the profound impact that this life-changing care can have on my patients.
And I'm Dr. Elizabeth Muhira Intaki, WellSpan Family Practice on Norman Drive. I take care of women across all stages of life, and I'm especially passionate about supporting patients through the menopausal transition with practical and whole person care solutions.
Hi, everyone. I'm so happy to be here. My name is Chris Lehman, and I'm a gynecologist at Ephrata OBGYN. And for about 15 years, I've been counseling women about their options during perimenopause and menopause. And now I'm living it myself. So I'm even more invested in making it as comfortable as possible for you and me. So together we're here today because menopause isn't just an OBGYN issue or a primary care issue. It's a women's health issue that touches every corner of our health system.
So, over the next 30 to 45 minutes, our goal is to move past the fear and misinformation that so often surround this topic. We're going to bust some myths that people commonly have. The ultimate goal is to empower you so that you are equipped with the knowledge to partner effectively with your healthcare providers and make the best choices for your body and your life. So, before we get into the symptoms and treatments, let's clear the air and bust some of the biggest myths out there. And as you're going through our presentation, please feel free to put questions into the Q&A and we will address them at the end.
So let's start with busting some myths first. The first one, myth number one, menopause happens overnight. This is false. If only it was that quickly. It's more like a slow Wi-Fi connection that takes forever to load. It is frustrating and highly, highly unpredictable. Myth number two, hot flashes are a minor inconvenience. Hot flashes can feel as though you're roasting in an oven preheated at 450 degrees, and it can significantly impact the quality of your life.
So, myth number three, hormone replacement therapy is dangerous for everyone. Absolutely false. The reality, HRT isn't a one-size-fits-all villain. For many women, when started at the right time, it's a superhero in disguise. Myth number four, sleep problems aren't related to menopause. False. The reality, tell that to the 3 a.m. women who are wide awake, pondering life's big questions because of night sweats and not being able to get back to sleep.
Myth number five, joint pain and bone loss during menopause are inevitable. This is false. Or it happens, but there's things that we can do to keep you from turning into the Tin Man. There's plenty of ways to stay limber and upright, protecting both your joints and your bones. And myth number six, you can't get pregnant during perimenopause. Yeah, you may know some people who made this a false statement, but surprise, your ovaries haven't fully clocked out yet. They kind of take their time doing so. So sometimes it is important to make sure you're discussing birth control with your doctor. So myth number seven, vaginal dryness is something that you just have to live with. This is false. Absolutely not. There is lotions and potions for that, and we do not need to suffer in silence or dryness. And myth number eight, menopause kills your sex drive permanently. While libido can certainly change, it doesn't have to go missing in action, and you can certainly talk to your provider about that, and there's many ways to rekindle that spark. So well, we did talk about those myths, and I'm sure there's other ones that you can even come up with or questions that you might have. But one of the things we wanted to kind of make clear was the definitions, because when you're looking at stuff, you kind of see all these different words and kind of what they mean. And there's really stages to this whole thing. As we mentioned, it doesn't happen overnight. It kind of takes a little time. And perimenopause is the time when people will notice this kind of gradual wind down, and this can last for several years. And what I tell people is it's characterized by higher highs and lower lows with your hormones. So everything that comes along with that, irregular periods, hot flashes, trouble sleeping, and sometimes mood changes. And the word menopause is really just a moment, or it's the pausing of your menstrual cycle. So it's that last period that happens after you've gone 12 months without a period. So I usually tell people you don't know it's your last period until you go a whole year, and then you're like, oh, that was my last period. And on average in the United States, the age is about 51 that this happens. And once you have that last period, then you've transitioned into the post-menopause time. And this is the time when hopefully most people will notice that their symptoms start to decrease a little bit. You're kind of on the downward swing, but there's other long-term health considerations that need to be taken into account during this time, particularly related to your heart and your bones and your brains. So there are special cases, right, where people have had their ovaries removed. So we refer to that as surgical menopause. And this is like happens suddenly and kind of almost overnight. So, depending on the people's age when this occurs, sometimes you will start on hormone replacement therapy pretty much a given, and then other times we kind of wait to see what kind of symptoms you might be having. So, now that we kind of understand some of these hormonal shifts that happen behind the scenes, let's talk about how these shifts show up in our daily lives. It's time to talk about symptoms.
So, before we jump into the symptoms, to truly navigate this transition, it helps to understand the why behind all the symptoms. So, think of this not as a failure of your body, but this natural and predictable biological shift. Your ovaries have been steady overachievers since puberty, working tirelessly every single month. But as you approach midlife, they start to consider an early retirement. This process is driven by a gradual depletion of ovarian follicles. Those are the tiny sacs that house your eggs. That gradual wind down means the production of hormones, particularly estrogen and progesterone, start to fluctuate wildly. One moment they're up, the next moment they're down, and that's what leads to that famous hormonal roller coaster that drives so many of the symptoms we're about to talk about. First and foremost, what people feel during menopause and perimenopause is real. It's a full body, full mind experience. Its symptoms are not just in your head. Research shows that at least 80% of women experience bothersome menopausal symptoms. So, because they're common doesn't mean that we just need to be enduring them.
So, probably the one that you think of the most or that you hear about are the hot flashes and night sweats. And these are kind of the hallmark symptoms. And they kind of happen for a fascinating reason. So, estrogen, when our ovaries are making estrogen, it helps to regulate the brain's thermostat, which is called the hypothalamus. But as estrogen declines, this thermostat becomes glitchy and it will panic over a normal body temperature and it triggers an emergency either cooling protocol or heating protocol, and that sudden intense feeling of an internal bonfire can occur. And sleep disturbances and mood swings are kind of deeply connected because these fluctuating hormones really disrupt some of our brain chemicals, particularly serotonin, and this can affect our mood. And then if you add in night sweats that are happening and your sleep is interrupted, you kind of get into this cycle of fatigue and irritability, and it can feel like you're on a hormonal roller coaster without a seatbelt. The other thing that can happen is this genitourinary syndrome of menopause. And I just think about this more as like vaginal dryness, pain with intercourse, and sometimes more frequent bladder infections or urinary frequency, urgency, those kind of things. And when we have estrogen around, you can kind of think of the vagina as like a lush, well-watered garden, and estrogen kind of keeps that in check there. But during menopause, the estrogen goes away, the gardener kind of leaves, and then things become dry and fragile. Sometimes you'll notice you'll hear people talk about brain fog. And that can happen cognitively. Our bone loss can accelerate and putting us at higher risk for osteoporosis. Many women will experience joint pain. I mentioned feeling kind of like the Tin Man when you get up from a chair or sit down. There'll be changes in your skin and your hair. And then, like I said about the brain fog, you kind of forget why you walked into a room and what you were there to do. Um, and, as I mention all of this, I kind of smile because I think we can all appreciate once we get there, or if we're experiencing it now, kind of what that feels like. You kind of forget why you went upstairs in the first place. So it could feel daunting. And some of these symptoms, you might be like, well, it's probably not, but like dry eyes, itchy skin, anything can really be included. And again, like we have said, it's not one size fits all. So some symptoms may be worse for some people. So let's talk next about what we can do to help you feel better if you are experiencing these symptoms.
So before we start talking about medications, I think we want to let you know that there are things you can start to do yourselves right now. The single most important principle of modern menopause care is that the treatment is individualized to you. There is no one size fits all. The best approach really involves a partnership between your physician, APP, and your own personal health goals and preferences. The foundation of any treatment plan is a healthy lifestyle. The first thing to talk about is nutrition. You are what you eat. A nutritious diet that is high in whole grains, vegetables, lean protein, and low in saturated and trans fats is really vital for your health. Please remember to prioritize your protein intake. A lot of women do not eat enough protein. You need at least 30 grams of protein with each meal. Each meal, I emphasize that. So to put it in context for you, one egg is 6 grams of protein. So imagine how short you're falling at breakfast. 4 ounces of chicken breast is about 30 grams of protein. And ensure that you're getting enough calcium and vitamin D at this time in your life because your bones really need it to be protected. Maintain adequate daily physical activity. Movement is medicine. Please do things that you enjoy. Bones and muscles really respond well to strength exercise. Aerobic exercising such as brisk walking or cycling really have got a great impact on your heart and lungs. Muscle strengthening with free weights, weight machines, and resistant bands are really going to maintain your muscle mass that can decrease during this time of your life. No, you are not going to bulk up, ladies, by muscle strengthening. In order to do that, you have to actually feed for it. And if any of you have ever watched a gym bro, even for 2 minutes, you realize that it's really hard to get there. Sleep hygiene, create a sanctuary in your bedroom. Please keep your bedroom cool, dark, and quiet. Some people do respond well to white noise. Stick to a consistent schedule, both over the weekend and on vacations. And also, what does not get mentioned enough is to have a clutter-free bedroom. They've done studies in pediatrics, and it really does go far to help you rest at night. Avoid all screens at least an hour before bedtime because that blue light does stimulate your brain. And avoid stimulants, especially later on in the day. For people who are ultra sensitive, it's been shown that caffeine can stay in your system for up to 20 hours. So please know your body. Avoid alcohol intake. That is a huge sleep disruptor. Mind-body practices, these are things like cognitive behavior therapy or counseling, yoga, meditation, prayer. All these go a long way to improve and manage your symptoms around mood swings and hot flashes.
So obviously those options are great and should be used pretty much all the time, even if you decide you're interested in trying something for hormone replacement therapy. But I'm sure, some of you are here to get information because there's some stigma around hormone replacement therapy, and you sometimes will get older people telling you you need to stay away from that for this reason and that reason. And really, it truly is the most effective treatment for many of the menopausal symptoms. So I wanted to spend some time here because no area in women's health is surrounded by more fear and confusion. Much of this fear traces back to a single event in 2002, and this was the Women's Health Initiative, the WHI study. And the National Institutes of Health had a press conference, and they released what can only be described as a clinical bombshell. The headlines were terrifying, creating a generation of fear among both patients and doctors. And what the press conference failed to mention were the study's positive findings, like reduced fracture risk and less colon cancer in some of the women that were using hormonal therapy. The message was very one-sided and the impact was immediate. That the hormone therapy prescriptions plummeted by a staggering 79% at that time.
So now let's review our modern understanding of hormone therapy. In the WHI study, they used a specific subset of hormones, and the average age was 63, and they sounded the alarms and applied it to everybody. And we know that hormone therapy is not a one-size-fits-all deal. It's about timing, it's about type of hormone selective, and it's about balance. So let's talk a little bit about the timing hypothesis. This is a really important takeaway. For healthy women who start hormone therapy before the age of 60 or within 10 years of their final period, in general, the benefits are going to outweigh the risks. In fact, for this group, studies show hormone therapy can reduce the risk of heart disease by nearly half and lower overall death rates by 30%. That's not just symptom relief, that's long-term health benefit that hormones can provide. The route matters. How you take estrogen makes a really big difference. Oral pills are going to go through the liver first. That's a process called the first pass metabolism. That triggers your liver to make more clotting factors and slightly raises the risk of blood clots. But when estrogen is absorbed through the skin, like in a patch or a gel or via a spray, it's going to bypass the liver completely. There was a landmark ester trial that found that oral estrogen carried a four-fold higher risk of blood clots, while transdermal or through the skin estrogen did not increase the risk at all. So for many women, the patch or a gel is a safer and smarter choice, but in the absence of risk factors and being earlier on in menopause, oral options are also good. Progesterone is essential. If someone still has a uterus, you cannot take estrogen alone. It must be taken with progesterone to protect the uterine lining because unopposed estrogen has an effect of increasing the risk of uterine cancer. So in our modern formulations, we use bioidentical forms like micronized progesterone, which are well tolerated and have favorable effects on mood and sleep. So estrogen and progesterone, they work as a team. One relieves the symptoms, the other keeps the uterus healthy. And so this modern understanding of hormone therapy is that you need to use it thoughtfully and individually, and it can be safe and life-changing. It's all about that balance, the right treatment at the right time, administered the right way.
So what benefits can, oh, I'm sorry.
So let's review some of the benefits of hormone therapy. When used appropriately, hormone therapy really provides significant benefits to you. It's the most effective treatment for hot flashes, night sweats. It reduces them by about 75%. It prevents bone loss and reduces the risk of osteoporosis and fractures. It effectively improves the symptoms of genitals, what we talked about, dry, I don't want to say dry vagina, but vaginal dryness and UTIs, enhancing that sexual health. It supports mood stability and improves sleep quality. When timed correctly, like we've indicated, it may reduce the risk of cardiovascular disease, and it may help protect against type 2 diabetes and improve metabolic health. Hormone therapy also helps preserve skin elasticity and improves your joint health.
Sorry, I was trying to rush rush ahead there. But so types of hormone therapy, again, this may be something that you hear from different people or read or listen to podcasts, and there's a variety of different ways that estrogen can be delivered. Um, Orally with tablets, gels that can be applied to the skin on a daily basis, skin patches, which can be used once or twice a week, and there's even vaginal rings that will absorb it through the mucosa of the vagina. And these different forms all work a little differently in the body, which allows us to personalize treatment based on each patient's needs, preferences, and medical history. And what's important to know is that most of these modern therapies contain estradiol, and that's the form of estrogen most similar to what our own ovaries naturally make. So, in other words, it's bioidentical, meaning the chemical structure matches the body's own hormone. So that brings me to our next topic, understanding what bioidentical really means and how to separate fact from marketing. So bioidentical is something that kind of came up, I think, as a result of the WHI because the FDA approved options for hormone replacement had such a stigma associated with them. Many other outlets were trying to come up with other alternatives because women were truly suffering. But what I try to, make sure people understand is that the FDA approved hormones like estradiol and progesterone are also bioidentical. Sometimes people, when they talk about bioidentical, are referring to custom compounded hormones that are not regulated by the FDA. Compounding pharmacies, however, do need to pass many requirements to become certified. So if we are using something that's compounded, I like to suggest that we use one that has the appropriate accreditations. FDA products can be guaranteed in their purity, their dose consistency, and they do have a lot of safety data associated with them, whereas compounding products simply lack that.
So let's talk about a little bit of the risks of hormone replacement therapy or menopausal hormone therapy. As with any treatment, it isn't right for everyone, and that's okay. The key is it's personalized. The goal isn't to scare anyone, but to help women make informed, confident decisions. When we talk about safety, it's important to distinguish between relative risk, where yes, your risk is higher, but menopausal hormone therapy may still be acceptable, and absolute contraindications in situations where hormone therapy should not be used because the risks clearly outweigh the benefits. So some of the absolute contraindications include a personal history of hormone receptor positive cancers, whether it be of the breast, the uterus, the ovaries, or other tissues in the body, a personal history of heart attack, stroke, pulmonary embolus, and deep vein thrombosis, certain known clotting disorders that necessitate somebody to be on lifelong anticoagulation. And if any of these apply, hormone therapy would not be appropriate. There are other conditions as well. However, there are still other safe options like non-hormonal medications and local therapies and lifestyle changes that can provide relief. For women without these conditions, the overall risk of modern, properly prescribed hormone therapy are very low, especially when started before the age of 60 or within 10 years of menopause. So the message I want to leave here is that hormone therapy is not this good or bad. It's a tool that we can use safely when it's prescribed appropriately.
So symptoms we had mentioned vaginal dryness, painful intercourse. These are kind of the local estrogen therapies. These come in very low dose creams, tablets, almost like suppositories or rings that can work directly in the vagina. They really have minimal absorption into the rest of the body. So for some of the people that have contraindications to other types of estrogen, this may be extremely, it's extremely safe for women to use even long term, and for women who may have had breast cancer or some of the other absolute contraindications. But there are also several non-hormonal options for vulvovaginal symptoms as well.
So not everyone can or wants to use hormone therapy. There are many effective non-hormonal options. So for hot flashes, we now have a very strong option called Veoza. There are other medications that have been used in the past to treat overactive bladder or nerve pain or depression that can be helpful for hot flashes. For the vulvovaginal symptoms, starting with something as basic as simple as using a daily moisturizer is extremely helpful, and using lubricants with intercourse. So a moisturizer I like to recommend, as long as somebody's not allergic to coconuts, is organic coconut oil. It can go a really long way for helping the symptoms of dryness. Even without hormones, there are safe and effective ways. So there's a no shortage of tons and tons and tons of over-the-counter products and direct-to-patient, direct-to-consumer marketing claiming products are going to balance your hormones or ease menopause naturally. These could have all different types of ingredients like black cohosh, soy, red clover, St. John's wort, dong quai, maca, and many others. Some small studies suggest a modest benefit, but overall, the research for these products is really inconclusive. When you compare them to placebo, these supplements generally don't provide consistent or significant relief for hot flashes or night sweats. Most of these products are safe to try, but I would caution that natural does not mean risk-free, especially dependent on somebody's health history. Quality and potency can vary widely since the supplement industry is not tightly regulated. And more recently, we started to see a wave of over-the-counter hormone products, particularly creams that actually contain estrogen and progesterone-like compounds in them, whether they be phytoestrogens or plant-derived progesterones. These can carry some of the same risks as prescription hormones, but without the oversight, dosing accuracy, or safety data. So in my personal practice, I emphasize that focus on the evidence-based treatments that really are going to work to help your symptoms, and discuss any supplements with your healthcare provider before starting them to know if they're going to be safe for you. So as we wrap up, I want to make sure you all know where to go if you'd like to learn more and explore some of these topics in greater depth. First, we have an archive of all of our menopausal chats that we have provided here at WellSpan with our internal experts. You're going to get coverage of a wide range of midlife and menopausal topics in detail, from sleep and sexual health to nutrition and hormone therapy. If possible, we'll put a link in the chat. Otherwise, when we send out the slides for reference, we'll have that information for you. Another excellent resource is the Menopause Society. Their website has tons of patient education materials, short videos, and even a podcast that breaks down the latest information in the menopausal space. The American College of OBGYN and the Mayo Clinic both have robust and trustworthy patient education about menopause symptom and treatments. So the key takeaway I want to impart on you is that reliable evidence-based information is out there. You don't have to rely just on social media or TikTok, and where there's a lot of conflicting advice. And so these are trusted sources you can turn to.
All right. And so now that you've heard us and you've heard about the different options that are out there for you, menopause is a natural stage of life. It is not a disease. The symptoms, though, are real, but suffering through them is not a mandatory rite of passage. None of us really need that street cred at the end of the day. A wide range of safe and effective solutions exists, and please feel free so that you can feel like yourself again. As you live today, I want to empower you to trust your experience. Your symptoms are real, they matter, and they really deserve to be paid attention to. Ask questions before you go to see your physician or APP. Write down your symptoms and your concerns and your questions so that when you get in front of them, you're not overwhelmed. Know your options. Remember that one size does not fit all. And you have the right to discuss lifestyle and non-hormonal and hormonal options. Advocate for yourself. You deserve to be heard and to be believed. and to be offered solutions that are going to work for you, not just so that you can survive, but so that you can thrive too.
So now that we've talked about the steps so that you can feel empowered, let's talk about the next piece, how to get connected with care. So you don't have to figure it out alone. In addition to my awesome colleagues at WellSpan, we have midlife and menopausal specialists across our regions who are ready to walk this journey with you. And our primary care providers are also part of that team. Many of them can address your menopausal concerns and initiate treatment. Schedule a dedicated appointment to talk about your menopausal issues with your PCP, and they can help you, or when needed, they can connect you with a midlife specialist if that's going to be the right next step.
Remember, menopause is not simply the end of a book. It really is the start of a new chapter in your life, one where you have more wisdom, of experience, and freedom to focus on yourself. So let's partner together to find out what works best for you. Because when women thrive in midlife, our families and communities thrive right alongside with us. Thank you so much for joining us today. If you have any questions in the chat, we will start answering them now.
And thank you all for joining us. And I also want to send a shout out to Tammy Crow and Melanie Martin. They both are in the background helping us to bring this presentation to you. All right, so a couple of questions. One question is, if I have a personal history, if I do not have a personal history of breast cancer, but there's a strong family history of breast cancer, is hormone therapy still an option? So there's not a clear-cut answer. It depends on shared decision making with your provider. But in general, even in patients that carry the BRCA gene, for example, hormone therapy may be used safely and effectively depending on their clinical situation. So that's something that I definitely would discuss with your provider. I don't know, Dr. Lehman or Dr. Meharry, any other thoughts for that question?
I think I agree with you. That's one to discuss with your physician. They can get a more detailed family history and see if any other testing is needed before you start any type of treatment.
Yeah, I would agree with that.
So next question is, what if someone has a prior history of pulmonary embolus? And so pulmonary embolus was one of the ones that was on the list of contraindications where the risk of hormone therapy may outweigh the benefits of hormone therapy in patients who have a history of a prior PE. There are some rare exceptions. For example, sometimes a patient may develop what's called a provoked pulmonary embolus, and it's not related to anything inherent in their body or genetic clotting disorder that they have. Maybe they were immobilized for 4 months after an orthopedic surgery. And those are, that's going to involve a shared decision-making conversation with your provider.
Agree.
So here's another question. I'm going to punt this to Dr. Meharry and Dr. Lehman. Is hormone testing recommended to know if a patient has entered menopause?
So we do say hormone testing is not recommended, right? Because as we talked about your definitions, when is menopause? A whole year after your last period. So we do not need to do any labs. The labs are not going to add anything to what we're going to do for you. In the perimenopause, ladies, your hormones are swinging up and down, and so we can catch them on a good day. And that is not saying anything. And so that's why in general, unless you've had a hysterectomy, unless you've had PCOS, have irregular periods, in general, we will not need labs to diagnose you. Dr. Lehman?
I would agree and just add, I think that the frustrating thing is that oftentimes people think that the labs would be able to tell us when that last period's going to happen or how long the symptoms are going to last. And there really is no, because everyone's so different, there's no level that's going to give us that information. So yeah, I don't routinely recommend that.
And so the next question is, there a list available of OBGYNs who are HRT friendly? Um, and I just backed up to this slide here to show all of our current midlife providers, but also PCPs like Dr. Muhiri are more than willing to take on the challenges of menopause and partner with you to get effective treatment on board. So, but these are our specific midlife providers where most of us also have full-time, general OBGYN practices, but we have dedicated midlife services that we offer as well. I don't see any other questions in the chat. So thank you all so much for being here with us. And I hope you all feel empowered to kind of take the next step and get some menopausal issues addressed or share this information with your family members or your other colleagues. Have a great afternoon, everyone.